Hi, my name is Tiffany Ellis, and today I will be talking about pregnancy signs within the first 3 months. So, first I'll go through the outline. And so, when a woman is pregnant, she will have her missed period, first of all, tender swollen breasts, morning sickness, nausea with or without throwing up, a heightened sense of smell, food cravings and aversions, slight bleeding and spotting, cramping, constipation, frequent urination, bloating, mood swings, fatigue, headaches, dizziness, mild discomfort in the lower abdomen, and the lower abdomen becomes harder, as well as having signs of heartburn. So, first, a woman will have morning sickness. So, this is with nausea with or without vomiting, and this mostly happens within week 6 of pregnancy, and this can occur as early as 3 weeks after conception, but a woman will mostly notice it at 6 weeks. And this can also play into a crucial role of like a heightened sense of smell. So a woman can get sick with a smell, and that will cause her to have vomiting, and that will lead to nausea throughout the day. And this can happen in the morning or in the night. It just kind of depends on each individual woman. The next one I will talk about is food cravings and aversions. And this is due to hormonal changes, hormones such as HCG, and this is produced by the placenta, so a woman will have cravings that she normally didn't have for food, or just have something random like, oh, I want some healthy food, or I want something that's fat and greasy. But this, like, aversions are crucial, and they also tell a woman what's good and bad for the development of the baby. And some foods may or may not be appealing as they once were. And then the next one is very, very common, and this is mood changes. This can be bad for the male and the female. And this is also caused by hormones. Hormones kind of cause everything that go on in pregnancy, but this can interfere with the brain's normal functioning and can cause chemical imbalances, causing a woman to feel super excited and then one moment feeling super down and depressed about herself. And this is very common in early pregnancy. The next one that a woman should be prepared for is feeling lots of fatigue. Your body is going through a lot of changes, trying to have the baby grow, and so it takes a lot of your energy to provide for the baby, and the body goes in overdrive. Progesterone is a common hormone that will play into your body and will tire it out. And this is caused by more blood being produced by the baby. And then the next one is heartburn. This one is not very fun. This is when the stomach struggles to break down the fatty, greasy, and spicy foods that you crave. And as the uterus grows, it puts pressure on the stomach and can push acid into the esophagus. And this is also caused by the hormone progesterone. And then, so each month, like the first month, they don't really have a feeling of new changes. It's mostly the cell being onto the uterus. It attaches to the uterine wall. And then the second month, you will feel fatigue, frequent urination, heartburn, nausea, and vomiting can get worse. And your heart also beats faster in order to carry the blood to the baby. And then the sign of the third month is a lot of weight gain. Some women can gain up to 5 pounds, and the breasts continue to grow and change. In the area around the nipple, the areola grows larger and darker in order to prepare your breasts in order to breastfeed. And then some women who are prone to acne may experience outbreaks. Then later on in the pregnancy, 10 weeks or so, a woman will have more vaginal discharge, and it is more of a whitish, thin, and clear and odorless discharge. And then more visible veins. You'll mostly see it around the stomach area for the baby. And that's caused to extra blood being carried by the baby. So those were just a few that I wanted to highlight, but there are also more signs that I didn't go into more depth about. But that's for another time and date. Have a good one.